Hi, my name is Anika Majaria and you are watching Dubai Live TV. I'm at the American Hospital with Dr. Viorica Khalili, who is a nephrologist here. Hi, doctor, how are you?
I'm fine, thank you.
Please could you talk to me a little bit about your role as a nephrologist and what interested you in this field?
Nephrology is a medical specialty that deals with diseases related to the kidney function and kidneys in general. Kidneys have multiple functions in regulating the internal environment of the body with keeping in balance the fluids, the electrolytes, the balance between the acid and the base load. Mm-hmm. They also contribute to the regulation of the bone metabolism and production of red blood cells. So nephrology deals with disorders related to all of these, and also with problems related to kidney stones, urinary tract infections. There could be also genetic or congenital diseases of the kidneys.
And what would you say are the most common kidney problems that you come across?
The rise in number of people who have diabetes and high blood pressure. There's more and more people who have kidney diseases related to the effects of diabetes and high blood pressure on the kidneys.
And how did these problems occur in the first place, and what are some of the symptoms that one should look for?
There are numerous causes of kidney problems, and they could be related to toxic substances that we can ingest, to medications that can be toxic to the kidneys. Sometimes there could be substances that are released internally from cells in case of extensive damage to the muscles or red blood cells. In this case, proteins that can be toxic to the kidneys can be released and affect the kidneys.
With regards to the toxic substances that you were talking about before, what are those toxic substances, especially the ones that we can ingest? What would those be?
There could be like organic solvents, certain alcohols that can be used as solvent substances, can be ingested incidentally or on purpose. Chronic systemic diseases like diabetes mellitus and hypertension. They affect many organs and systems, and the kidneys are included.
With regards to diagnosis, what tools would you use for diagnosing patients?
The clinical exam is the first step, mm-hmm. and that would help establish simple things like the blood pressure, heart rate, then interviewing the patient to see how the disease affects the person, to establish what would be the next step in terms of diagnosis. Then laboratory tests are used. Urine analysis, it would be a simple, quick test to have an idea about the kidney function. And besides clinical examination, laboratory tests, imaging tests can be done. In terms of kidney ultrasound, CT scan of the kidneys and bladder, to look at the anatomy, the structure of the kidneys, to look for abnormal structures like kidney stones, kidney masses, cysts, to see if there's any blockage for the drainage of urine that might affect the kidney function. Nuclear medicine tests can be done also to assess the function of the kidneys and the structure.
Thank you so much, Doctor. That was a great informative answer.
It was a pleasure talking to you.